That was a long time ago. This is obviously the Ruth Fertel Clinic, but it obviously was the original Ruth's Chris Steakhouse, was it not? Yeah.
Yeah.
It's really good. But I want to thank y'all for being here. I want to especially thank Access Health, Louisiana, for making this possible, and the folks here at the clinic. I want to thank Dr. Scott Martin, who's here with us, and Ms. Ruth Kennedy as well. You know, tomorrow is 1 year since the Medicaid expansion took effect. And in 364 days, I guess, we have about 433,000 working poor people in Louisiana with health care coverage who didn't have it before, and most of those people have never had it at any time in their lives. And so what we know is that the access to care now that's made available through the Medicaid expansion for that population is allowing them to have a better life, a higher quality of life, because they can access primary and preventive care. And we know that 100,000 have already done that. We know that of the 100,000, we have about 310 people across the state who are now being treated for cancers. These are just breast cancers and colon cancers that they didn't know they had before. They would not have known, but that card gave them access to diagnostic evaluations where the cancer was revealed, and now they're getting treatment. But it's more than just that. It's the 30,000 people who've been diagnosed with hypertension or with diabetes who are now getting treatment earlier in those disease stages so they can be treated more effectively and more cheaply and keep them happy and productive. Whereas if you let those disease stages get to the point where they're feeling so terrible that they go to the emergency room, that is the most costly way to treat them and the least effective, and you cannot manage disease out of the emergency room. So we are literally saving lives. And I know that people don't like to put it in these terms, but it is true. If we are saving lives through the Medicaid expansion, that means if we take away the Medicaid expansion, people will die. And we can't be afraid to just put it in those terms because it is the truth. And look, our uninsured rate went from 24% to somewhere around 10%. I think it's actually a little lower than 10%. Last year, we only had 6 months worth of expansion whenever they surveyed the state. This year, we'll know better, but I think it's a little less than 10%. We have never, ever approached that level before in our state. And it's important not just because we're saving money, not just because more people have that card in their wallet, but because we know we are turning the corner on delivering better health outcomes for the state of Louisiana. It shouldn't be this way, but our state is poorer than it should be, and our health outcomes have been much worse than they should be. And that's why it makes all the sense in the world for us to go through the Medicaid expansion, but now that we have it, we've got to fight to keep it. Because there are some folks in the country today and in the United States Senate, and please don't be fooled by the title they put on their bill. They call it the Better Care something or other. You know, it's just, we need to make sure that we're speaking out. This is the right thing to do for the people of Louisiana. And as you all know in this room, the folks who are benefiting from the Medicaid expansion are working people. For the most part, if they didn't work, they would have qualified for the traditional Medicaid program. And so it's just incredibly important that we tell the story. We've got a lot of work to do. Certainly it's not perfect. We can always make it better, but it is so much better than what we had before. I said when I became governor, and on the first full day in office, I signed the executive order expanding Medicaid. I said, this is the easiest big decision that I will ever make as governor. Well, a year and a half later, and a year into the expansion, I can tell you, it is absolutely the easiest big decision I will ever make as governor. And it has been successful beyond anything that I had ever imagined in terms of our providers. I don't care whether they're big hospitals, rural hospitals, FQHCs, you name it. The Medicaid expansion has been critically important to them. And we are widely recognized, and the people in this room, because you're here in Louisiana, you've been working every day at this, you may not know this, but I travel the country and I go to meetings with all 50 governors, and I go to Washington and other places. Our expansion is widely regarded as probably the best in the country. We did it better. We did it cheaper than anybody else. And part of that was because we had the benefit of the experience of other states who went first, and we were able to learn from their mistakes and incorporate best practices. But a part of it was also the excellent people we had at the Department of Health and elsewhere in the state of Louisiana to guide that effort. And that's what this lady did right here for us. And so I'm so glad that she came out of retirement to be with us today. Anyway, I just want to thank y'all for being here. And I know that at this point, I'm supposed to turn this over to whom? Bridget Carbo? Ruth? Okay, good.
Well, I just have to say that a year ago today, it was a Friday afternoon, a very hot Friday in Shreveport. We were on the eve of Medicaid expansion. We were very optimistic, didn't know what was going to happen. One of the things that Governor Edwards said is, yes, we have already enrolled several 100,000 people, but that is not the end game. Unless we see improvements in people's health, this is not going to be a success. And so that's why the kinds of statistics that that the governor has cited today, that people are getting access to care, to be able to be in better health, and to go to their jobs. It really is about our workforce and economic development in the state. And I have to say that as a representative of the employees in Medicaid, how painful it was for more than 2 years for us to sit on the sidelines and see other states who were just, the disparity in health care access was just continuing to grow. And so elections have consequences, and you know, we didn't have very much money for outreach or to enroll people, did we, Representative Marino? But one of the things that we had was priceless, and that is a governor who was willing to go throughout the state as a champion for Medicaid expansion. There is no amount of money that can buy that kind of passion that he displayed. And so when I think of, you may be familiar with the scripture from the book of Esther that says, perchance we were created for such a time as this, not only for the governor, but for those thousands of people, literal, and this is not an exaggeration, thousands within the department, within other state departments, our providers, our health plan stakeholders who made this happen. And so I just, as the governor said, I think that we can say at the one-year birthday that it is a success. And for Access Health and all of our others who are here, thanks for helping us to get here.
Thank you. It's your turn.
All right, well, I'm not used to being in this situation. I'm a little bit warm.
It's a little warm in here.
Medicaid expansion in this state was an absolute game changer. I spent my career, I trained in this building. I did, I'm Dr. Google here. We had uninsured patients for years. It was, and many times, a very hopeless and fractured system. It was not fun. I spent a year out after residency in a place that was more Medicare associated, so I did not even realize how big a deal Medicaid expansion was until I got back into an FQHC, which is where I work now at Excelf, just a few blocks down. You know, you said something about not framing it in terms of people dying or living and what have you, and to be frank, I think that's actually the exact way to frame it. I can guarantee you that the years prior to expansion led to the untimely deaths.
And what I meant to say was people don't like us framing it in that way,
Correct.
but we have to. They don't want to say if you take it away, people will die, but guess what? Take it away,
People will die.
people will die.
Absolutely. And maybe as we speak, we'll give you a story or two about various patients, but it's absolutely true, and I completely agree with you. So that's why it's important to defend it. This is why it's important to be here, and that's why I wrote the article I wrote, and that's why I continue to work in the way I work, and I applaud all my other colleagues who do the same, because there's nothing really individual about myself other than I care and I show up at work every day. And I applaud you, Governor, for the expansion, and I certainly hope that in this battle we win as we move forward, because it's absolutely necessary for the state of Louisiana and really for working poor Americans everywhere. I mean, we're looking at it in one state, but we've got 20 million folks who are going to lose coverage over the next 10 years. That's completely unacceptable, and I support you, and I'm very happy to be here. Thank you.
Thank you. Look, there are 30,000 people who've received treatment for mental illness. There are 8,000 who've received treatment for addictive disorders, and we're fighting an opioid epidemic. I mean, the idea that we would take this away from people, it just shocks my conscience, and so we just have to speak with one loud, united, strong voice, and make sure that we're heard by our congressional delegation first, and by other folks as well. Now, around the table, I believe, are some individuals who are benefiting from the Medicaid expansion and have some stories to tell. And what I would ask you to do, and I think this is next in our program, isn't it?
Yes. Yes.
Okay, is to just take a couple of minutes and introduce yourself, if you will, and let us know how the Medicaid expansion has impacted your life.
We're going to start with Ms. Rashida Taylor.
Hi, I'm Rashida Taylor. Well, I was a transplant. I moved here from Texas, and in the process of establishing myself, I came at a time right when the expansion program came online in June. It was really a help for me and my daughter because as I found employment, you have that grace period before you're eligible. So with having the program, it allowed me to take care of myself, my pre-existing conditions of diabetes, and my daughter with her asthma. And now that I've been here a little while and I'm employed with the medical facility, I have the employer's option to have health care, and so I'm no longer on it, but that's as of June 1st of this month. So it's taken me from the time that we moved here to this month to really be able to just take care of ourselves, our medical needs, and not have the stress of not being able to afford it.
And see, she just kind of made the point, is this really helped working people more than any other group, and not that everybody who avail themselves of Medicaid expansion is gainfully employed, but the overwhelming majority are. And so people try to distract, and they say, well, we need to put a work requirement on it. Well, they're working. And those who aren't working are probably too sick to be able to work, which is why they need health care to begin with, or they might be in college, that sort of thing. So anyway, thank you so much for being here and for sharing with us.
Thank you.
Hi, my name is Leola Reed, and it helped me as far as medicine is concerned. The cost of my medicine has went down tremendously, which I really love, because if it hadn't, I would have not been able to get the medicine to take care of my household. So that's how it really has helped me, and I really appreciate it.
Well, and thank you for being here and sharing with us as well. One of the things about the bill in the Senate right now is it does nothing to drive down the cost of health care overall. She mentions pharmaceutical drugs. That's one of the biggest cost drivers in the increased cost of delivering health care in the country. But this bill does nothing to address that. It would just make it harder for her to afford medicine, but it wouldn't do anything like allow the purchasing power of the Medicaid system to be brought to bear in negotiating with pharmaceutical companies the cost of the drugs to begin with. It would just, so it'd make it harder on you, but not do anything to really change the system. So thank you very much. Shauna, who's next?
I'm Lisa Lynn Kotnick, and I was a part of the Musicians Clinic for several years as a performer. I think mine's more about the medicine I've been able to receive. I have an Achilles tendon injury from, it's not necessarily a sports injury, but from working in high heels for many years on stage, and also from working behind the bar. I've been able to go to 10 months of physical therapy now, and my chances of not having to have an Achilles tendon surgery are at like 90%. a chance that I don't have to have that surgery done. I also had a spot removed that could have possibly turned into cancer. So that was another preventative thing that happened that was very beneficial.
Well, I appreciate you being here and sharing as well.
Hi, I'm Sherry Jackson, and I have diabetes, but everything is okay now with the medicine-wise. I used to pay $25 or $30 for the medicine, but now since I'm on the Medicaid and stuff like that, when I go to the to the pharmacist, and when they say such and such, and I'm like, huh? You know, I be like surprised and stuff like that, and how much the medicine costs and all like that. This is my doctor over here, Dr. Google.
All right.
Yes.
Well, I mean, just to speak for Miss Jackson, she has, if you look at some of the data that we look at in terms of her medical conditions, and the availability of some of the medications that she's referencing, we've seen a dramatic difference. She has taken it upon herself. She's gotten good insurance, and she's taken it upon herself to really turn her health around. And,
I take 4 shots a day. I take 2 in the morning for breakfast, and I take 1 for lunch and 1 for dinner. I have pressure problems.
You eat too, though, don't you?
This is not no fast food. This is my cooking.
Gotcha.
But we really have seen a dramatic difference in her health just in the last year, and I attribute a lot of that to access to medications. I've known Miss Sherry here for probably 3 to probably 4 years now, and we struggled a lot getting medications for her, the appropriate medications for her for a long time. And she would call me up and she'd say, "Dr. Google, where's my medication?" I said, "We're trying to get it for you," and all this stuff. And now we don't have to deal with that anymore. It makes our job remarkably easier for something simple like, hey, can I get my the medication that everyone else with insurance can get that can treat this problem? And if we treat this problem, we can prevent all those complications that unfortunately we see here too much in Louisiana at too young of an age.
Yeah.
It's really...
I have a diabetic doctor here too. Dr. Google, he's good, but I don't give him the credit. You know? For the diabetes, no, I don't. But working with my diabetic doctor, she started with the low dose. He came with the big dose. But it's with her with the low dose that really, do it. Yeah. But he's good. I give him no credit. But I can call him up and I can say, look, my asthma's acting up. I don't have such and such medicine. Well, where is that? I ran out, but so I think I've been with Dr. Google between 6 to 7 years. No, I wouldn't go nowhere else but him.
Well, I'm glad to hear that. Thank you, Ms. Jackson, and thank you, Doctor. Yes,
Hi,
ma'am.
my name is Kathy Hammond. I live in St. Bernard Parish, and that's my husband sitting in a corner over there. And Dr. McDermott is our doctor. And we were on the NOKI program. My husband was unemployed at the time, and in July, it automatically switched to the expanded Medicaid. And it was fantastic because he was diagnosed with diabetes. I was diagnosed with diabetes. She found this all out. He has vertigo.
You didn't know you had diabetes
No.
before?
No.
So rather than it progressing and getting much
Yes,
worse before
because
you
we didn't
knew-
have medical insurance. So we couldn't afford to go to the doctor. The medical insurance that I tried to get was between $800 and $900 a month, $2,500 deductible per year per person. So we couldn't afford it. We still cannot afford it. He works now. He's a driver for a port ship. They offer medical insurance, but it's outrageous, and their deductible is ridiculous. We just recently lost our Medicaid in April because we make too much money.
But to be clear, she only makes $3,000 too much over the
Yes.
Cutoff. And I think I brought her here because I think she is the example of, occasionally her 30-year-old daughter moves back into the house and her teenage granddaughter moves in, and the size of the household fluctuates, and how many people depend on them, and the one job that Parker has fluctuates. And the Medicaid has been very beneficial for them.
Very.
for getting them to a place of health, and now she's just crossing her fingers until she qualifies for Medicare in a year and a half.
Yeah.
But it got you back to where you can go back to work?
Yeah, he's,
I mean, that's part of this too, and it's incredibly important. And I understand the 138% of federal poverty, it's an arbitrary line. The line was going to be drawn somewhere. And it was always envisioned that people would kind of go, you might get to where at some point the income was slightly above that line and you would lose it.
that's what happened.
But if you lose part of that income, which I hope you don't, and you come back, you requalify. Under the bill that the House of Representatives passed in Congress, once you lost it, you would never be able to come back and get it.
Yeah.
So understand what that was about too.
Right. But I mean, it helped us a lot. He has one medication for diabetes that's like $480 a month. We can't afford that. There's no way.
Yeah, but now that
You
you know
know?
you have diabetes, it isn't all about the medicine. You know to take better care of yourself.
Of course.
You know to
of
exercise.
course.
You know to eat right,
Yes,
and
yes.
without knowing that, your
Yes.
disease is gonna progress
Exactly.
more rapidly,
Exactly.
and then you wouldn't ever be able to work, and your quality of
Exactly.
life would be much poorer.
Yeah.
And that's what I'm saying. This is about saving lives. It's about improving lives. It's about quality of life for people, working people such as yourself. So thank
She's
you
been a
very much.
lifesaver, really. I mean, I can pick up the phone anytime and call her, and she's there for us. Even though right now we don't have any coverage. She's still, I got samples, come and pick them up. You know, she does what she can. But we need to get back on it. We need to. You know, it's just,
I think I spent the better part of 2 years or 3 years when we still had Noki, memorizing the Walmart $4 list. But things have sort of changed, and the types of medications that are offered for diabetes with the complications of hypoglycemia really make them a lot less attractive than some of, past metformin. The sulfonylurea is not so nice, and then everything else that's available really has a much better side effect profile, is a lot easier for the patients to use. But because they're newer medications, then they cost more. And so the Medicaid expansion certainly, the complication rate from diabetes from the use of medications that I prefer not to use has definitely gone down. I don't get, life-threatening hypoglycemia. I'm not worried about kidney function so much anymore in my patients and what kind of medications I'm
yeah,
taking.
this medicine under the Medicaid was only $3 we paid.
Yeah.
And then all of a sudden it went up to $480
When you lost your Medicaid?
and we lost the Medicaid,
I guarantee you, that's not what Medicaid was paying for.
Yeah.
No,
But we're
no,
back
no.
to the patient assistance programs and all the things that work for us again.
Yeah.
I just wish I didn't have to be there.
Understood.
Yeah.
Thank you so much, and thank you, doctor. It's time to hear from a gentleman here. Hearing from all these ladies.
Hey, thank you. It's a pleasure to be around all y'all. Thank y'all for helping us out with the health care. And, I got confused at first, but now I'm back in the field, so now I feel like a person. And I thank y'all for helping me when I had the heart attack. And, after I had the heart attack, I had to fight with the lupus in my feet, and came from one foot to another foot, and I was getting frustrated, but I kept strong and kept going to clinic. They was motivating me, and as time go on, and it was getting better for me, and I thank God. And it's like the lady mentioned about the prices. It was hard on me. Then I was working when I caught the heart attack, and it was hard, but I fought it, and I was listening to y'all, and voting for you, and for everybody in here, and I thank y'all for from being there for us, because I was hoping, and one day I said, wish I can find some people that can help me fight this away, fight the power, and help the governor and everybody else, and help each other. That's what we try to do. Like, we got an organization around here I'm trying to establish for the children. So
Well,
I thank you for.
Has your health improved enough to where you've been able to go back to work yet, or no?
Not yet. He said I can go back to work, but I'm getting my check, I ain't gonna say the little check, but my little check, I thank God for it, and I want to go back to work, and I miss it, but I do a lot of stuff around the house, and I thank y'all for the.
Well, thank you very much for being here with us.
Yes, sir.
Okay, I know we've got some, I'm sorry, go ahead.
I'm Danielle Watkins, and I came back to Louisiana after a layoff 2 years ago, and I had insurance, but I was paying for it, and coming back here, you know, with the layoff, you know, the insurance didn't carry over. So I want to say that the Medicaid expansion, it really benefited me because when I first moved back, you know, you had to have children in order to have Medicaid. I don't have children. So it was a blessing for me because now I'm able to afford my asthma medicine without having to the stipulation, oh, well, you don't have children, you can't get this. And it really did help me, and it does help me as far as with my medicines. So.
Thank you.
We can hear from some of the doctors and lawmakers. Dr. Briggs?
Yeah, well, first, outside of the fact that I really appreciate his name, Mr. Eric over here, what this Medicaid expansion, I'm the Director of Community Medicine here with Access Health. Spent a lot of time in the community, just left from downtown. We're doing screenings with the 100 Black Men at the Convention Center. And I didn't know any of this about Mr. Eric, but what has happened, the conversations have changed in the community, in the barbershops, the beauty salons, the churches, the schools where I spend time. Whereas before you'd walk in the room and mention something about health or a health screening, and everyone would run. And you wonder why. Well, there was nothing they could do about it. There was absolutely nothing. And as you probe, for generations, you'd hear about mom or dad going to work and having a heart attack, 45, 50, grandma dying at 60. So it's something that they didn't want to deal with, and there was nothing we could do about it. We couldn't afford insurance. Well, as I'm talking to Mr. Eric here, not only is he looking to get back in the game, he wants to come volunteer to help screen other people for their blood pressure. So it's shown the heart of who we are as Louisianians. Did I say it right? I should have practiced that one. Louisianians. It's not, we can take care of us. And that now the screenings and the things to do to take care of ourselves, because we know if something's wrong, it'll be taken care of. That's what Medicaid expansion is. That's the word on the street, I'll say.
Yes, sir. Thank you.
Yes.
I'm a pediatrician. I work in our Kenner office, and so I guess I do get the benefit. I see a lot of our kids are just on Medicaid anyway, but they come to that transition, and before the expansion, it's kind of like, what's going to happen? You potentially have your asthma under control, and then all of a sudden you can't afford your meds. They go off to college, and they kind of lose all that preventative care that they had access to. And also with their parents, like you were mentioning, there's generations where they just couldn't afford the care. And so with the expansion, now we can go back to being more proactive with our health and preventing things and finding it earlier. And I think it'll trickle down, and so as the kids get older, now they're going to know this is important. And hopefully we'll see the better outcome in the future where we have more healthy adults. They're working, they're being successful, and then their kids behind them follow the same way.
Well, thank you. Well,
Governor, I just want to, on behalf of the people of the city of New Orleans and my district, I just want to thank you. There's so many things about this that are striking, and you've spoken to the moral obligation, the quality of life, the saving of lives that has happened with expansion, and people that know you and have the benefit of knowing you, and as some of us have been able to serve with you, know that you fought for the NOKI waiver program, know that you have fought for this for years, and that it took you becoming the governor for it to become a reality. And so I want to thank you for that, but not what everyone doesn't understand is how this has also restored some of the health to the state budget. Yeah. And as we continue to struggle with financing those priorities and those things that we know will make our state a stronger and better place, you've been able to work with providers and with managed care organizations and others, hospitals, et cetera, to bring additional dollars to the table to take care of the people of the state. You've spent, we've been able to spend less state general funds, so less taxpayer dollars from people of the state of Louisiana, draw down additional billions of dollars that our people have sent to Washington, and use that in our clinics and with our providers to pay for health care for the people of this state. And so not only are you working to make individual lives better and help them to live healthier lives, but you're restoring some health to the bottom line of our fiscal house. And I think that's really critical that people understand that you're accomplishing those two things at once. And I know that I'm very proud to work with you to do it.
Well, thank you. And first of all, it's a team effort. I suspect more than anything else, my election as governor made it possible because we had a governor who just refused to do it. Had I not won, I'm quite certain we would not have done it. But it is a team effort. But to Walt's point, by simply bringing our federal tax dollars back to Louisiana, in the present fiscal year, the one we're in until, tomorrow, we saved $200 million state general fund. For the year that starts tomorrow, we're going to save $300 million. And we are now using that money, and Ruth doesn't want to hear this, but it's not all staying in the Department of Health, but some of it is, obviously, but we're supporting our K-12 schools, we're supporting higher education, we're supporting all sorts of stuff with that savings. And so it is critically important, especially with the budget constraints that we've had. And I will never apologize for bringing our federal tax dollars back to Louisiana to take care of our people. I mean, I'm very proud of that. Representative?
Governor, it's good to see you again, and I also want to welcome you to the city of New Orleans, and on behalf of Elgis, the West Bank, welcome you back to the city. And you said something profound when you were talking earlier, and that this was the easiest big decision you had to make. And I think it was the easiest big decision you had to make, and I've got to see this over the course of the last 2 years working with you, and that is because you put people over politics. And I applaud you for doing that, for putting the people of this state over politics. And for doing this, what you're doing now. We're listening to the people. You know, we're listening to the people explain how access to health care is saving their lives, how it's improving their families, how it's helping them return to the workforce. And I know that there are some of our elected officials who are struggling. I know that there are some of our elected officials who are struggling in D.C. with making what ought to be an easy decision. And I encourage them to do what you're doing now, and that is listen to the people. Listen to how it's saving their lives, improving their families, helping improve the economy, returning peoples back to their communities and to work, and also improving the community, and to listen to the doctors who are treating them. And so I call upon our U.S. senators, I call upon our U.S. congressmen to do what you're doing, Governor. Sit around the table and listen to the people. So I applaud you. I applaud your good work. I certainly appreciate working with you, and thank you for your service, Governor.
Thank you. You know, I tell people all the time, and I don't want to get into these various policies because that's not the purpose of why we're here today, but the same Catholic faith that leads me to be pro-life on the issue of abortion tells me that I should be pro-life as it relates to Medicaid expansion, too. And so I like to share that message sometimes because there's sort of a dichotomy there sometimes. And by the way, one of those positions is thought of as being very conservative. The other one is liberal, but they're informed by the same faith. And so I don't like the labels. I don't know that the labels really communicate anything. But thank you very much. Elena?
Well, thank you, Governor, for being here. It's always nice to see you. And I just have to applaud you for your leadership in this. We've been working on this for quite some time, the legislators who are here. And, you know, I'll have to tell you a quick story. So, and Ruth Kennedy, by the way, this right here is the woman who rolled it all out, okay? I mean, she must be applauded for the work that she did. She really did. Story, the governor got elected, and I said, Governor, you know, this is a time when you can finally do the Medicaid expansion that he's been working on for so long. And I said, what can I do to help? He said, why don't you go on up to Washington, D.C., and go meet with the folks at CMS, and go take Senator Mills with you and some other folks, and y'all come up with a plan. And I'm like, well, I don't even know anybody at CMS, but okay, we'll go. And we started working from there to come up with a plan. Ruth, I was meeting with you, and at the time, you know, we were trying to figure out how to get more staff so that we could do those rollout. But it was because of John Bell Edwards' leadership that we were able to get this done, and you were able to get your staff, and we were able to provide coverage for now more than 400,000 people who didn't have it. And Governor, I just can't believe that we are sitting here and even discussing the fact that a program that is saving lives and also leads to cost savings may be going away. Yeah. Unbelievable. So I think that at the end of the day, what really tells the story is the numbers that we see here on page 5, which is the individuals who went through preventative care screenings And the individuals, because of these screenings, who of course ended up finding out that they were suffering from either a cancer or a serious disease like diabetes, these right here, these numbers are people and these are lives saved. So thank you for doing this, and let's just keep fighting to make sure that this remains.
And that's a snapshot of what we've done in a year.
Mm-hmm.
Think about how much more is going to happen.
And I guess the sad
As we
part,
move
though, is,
forward.
Governor, is the fact that, you know, as Ruth, as you had mentioned, too, that we didn't roll this out initially. Think of the lives lost.
Well, not only did we lose lives, but if the Senate bill should pass, and I pray that it doesn't, and it's not changed, because we didn't expand earlier, Louisiana will suffer more than any other state, because the way they're going to base our Medicaid payments from the federal government going forward are based on 8 quarters. Well, we only have 4 quarters with the Medicaid expansion. So the other 4 quarters won't show those expenditures, and when they lock in our base, we will forever be punished going forward because we didn't expand earlier.
Mm-hmm.
Now, they need to fix that. First of all, they shouldn't move forward with the bill. But if they do, they have to fix that. And I call upon our congressional delegation, particularly our 2 senators, Senator Cassidy and Senator Kennedy, that even if they support the bill, and I urge them not to, they cannot support it in its current form because it singles out our state for punitive treatment. And not John Bell Edwards. It's you all. Punitive treatment. Yes, sir.
Yes. As we look at this part, and Governor, I can echo Representative Lejay's sentiments exactly everyone's here on your leadership and the ability to have the courage to stand up and say what you're going to do and do it. And it was very easy, and it's very easy for me to work with you and support the efforts that we've made so far in this state. And Ms. Kennedy, I want to thank you for your hard work and diligence, as you always have committed to doing so. But I bring thanks with me from the residents of Jefferson Parish, some who I represent. One particularly, I don't have a real story, but there's a constituent that I have who suffered with lupus. And she had to continually go to the emergency room for treatment when her illness, she had a reaction. And now she's able to afford insurance and get the care regularly. But several people who I've talked to over the past year and a half, and the doctors can pretty much attest to this, the anxiety of where you're going to get treatment at and how you're going to get your next medication for your sick adds enormous amount of pressure to those symptoms of every illness that you actually have. So there's a large peace of mind that comes with everyone who accesses insurance coverage now that can have that. I can get treatment now and not have to stressfully worry about so much, because stress is a big killer when we have those diseases that people can't get treatment on. So thank you very much for it. And we're here, and there's so many people who can't be here who are, I'm saying thank you for them, that we continue to work for them and going forward, and urge our Senate delegation, our congressional leaders in Washington, we have to fight for the people of Louisiana, not the DNR people, the people. And thank you very much, guys.
Thank you. And I think we're about to wrap it up, but you just mentioned something that's really important. My mother was an emergency room nurse at a charity hospital, and this is in North Hansborough Parish. Most people in the parish who didn't have insurance, they went to my mama for their health care. And so you pay that price every time you go to the hospital with an emergency, and you're in a line behind people who don't have an emergency, but you're going to access care for yourself and your children, right? And so it just doesn't make sense to go back to that system, which we know wasn't working and costs an awful lot of money and doesn't deliver the level of care that we can through the Medicaid program. I know we're about to wrap it up. Y'all have been very patient, and I know it's warm. I think that's a heat sensor over there. But y'all have been very patient, and I want to thank y'all so much for being here. But as we celebrate Independence Day and everything that's right and great about this wonderful country that we live in, let's make sure that we are praying for our leaders, that they will make the right decisions, the best decisions for our country, and let's make sure that we're communicating with them so that they know what it is that this program has meant to you and to your families. So thank y'all very much. God bless you.